Can we officially call you the gut guru?
After the US, highest number of cases of IBD are in India.
So it was the gut calling or the gut feeling all along, antara?
There is misbalance between the good and bad bacteria. So it's a combination of genes and environmental factors.
So when a particular diet on that they should follow, or certain foods that they should avoid.
Most important is timing of diagnosis. Quality of life is not hampered. They are as good as any other person.
Is there any gut secret that you follow personally?
Gut microbiome determines your gut health. Not just gut health, it determines your general health also.
So welcome to the program, doctor, and it's a pleasure to have you.
Thank you very much.
Can we officially call you the gut guru? What made you choose this field of digestion? And they love at first sight or love at first scopa?
When I was doing my general medicine, I didn't have much passion towards gastroenterology. But immediately after my MD, I worked in a gastroenterology department before joining my super specialty. That's where I fell in love with the department, with the, you mean to say, gastroenterology and liver.
So it was the gut calling or the gut feeling all along, antara?
Yeah, something like that.
So మీ రోజంతా you talk about bowel movements, gas, bloating. అది మీకు ఎలా అనిపిస్తుంది? అంటే given a chance, would you still stick to the gut?
Actually, yes. See, when I talk to my patients, for example, immediate post-operative period, or sometimes in a patient who presented with some subacute intestinal obstruction, first thing I go and ask the patient is, did you pass your flow test today? మీరు గ్యాస్ పాస్ చేశారా? దట్స్ యాక్చువల్లీ థింగ్ విచ్ ఇస్ హెల్పింగ్ మీ నో దట్ ద పేషెంట్ ఈస్ ఆల్రెడీ ఇంప్రూవింగ్. సో ఐ స్టిల్ ప్రిఫర్ ఆస్కింగ్ దెమ్ బికాస్ ఆఫ్ దట్ ఈస్ ద వెల్ బీయింగ్, దట్ దే ఫీల్ గుడ్ అండ్ ఇట్ ఈస్ యాక్చువల్లీ దే ఆర్ బీయింగ్ హీల్డ్ ఆల్రెడీ. సో డెఫినెట్లీ ఎస్.
So we are here today to talk about IBD, the Inflammatory Bowel Disease. So how common is this condition in India? అంటే ఇంతకు ముందు మనం అంతా వినేవాళ్ళం కాదు ఈ కండిషన్ గురించి.
IBD, at least 20-25 years ago, it was thought to be a disease of the Western world. ఈ రోజు today, after the US, highest number of cases of IBD are in India. You are seeing more of ulcerative colitis in the northern part of India. You are seeing more of Crohn's disease incidence in southern part of India. So we are seeing a lot of IBD cases. And today, most important thing would be last 25 years ago, what changed is the type of food we are eating. That has changed most of it. All of us were carrying these genes.
Following the Western culture.
Western culture.
Yeah.
So that is why we are seeing the presentation more.
So అసలు IBD అంటే ఏంటి డాక్టర్? అంటే is it like your own gut is fighting against your own body?
Exactly. See, IBD is nothing but your not the gut, your defense system. The immunity is the defense system in your body is fighting against your own gut and causing damage to the intestines. So this is to simplify and make people understand about IBD. So it is see, normally what we used to understand is good bacteria, bad bacteria in the intestine. When there is increased bad bacteria, it causes infection and symptoms. But here, when we are talking about IBD, it is again there is definitely the starting point is there is misbalance between the good and bad bacteria, and there is also wrong information to your immune system. Your immune system thinks even the good bacteria or the intestine is a foreign body and starts attacking it. So that's to simplify IBD. So that is when the problem starts, and once it starts, it increases
కంటిన్యూ
అవుతా ఉంటుంది. Yes.
సో ఈ కండిషన్ అనేది IBD ఎవరికి ఎక్కువ ఎఫెక్ట్ అవుతుంది అంటారు? ఇస్ ఇట్ ఎనీ స్పెసిఫిక్ ఏజ్ గ్రూప్ ఉందా, జెండర్ ఉందా, ఆర్ ఎనీథింగ్?
See, gender wise not much different. Males little more than females, but age definitely got 20 to 40 years.
That's pretty early actually.
Very early. And there is a second peak. Second peak is after 60 years.
అంటే జనరల్‌గా సిమ్టమ్స్ ఎలా ఉంటాయంటారు? ఎందుకంటే యూజువల్లీ మనం ఏమన్నా గ్యాస్ట్రిక్ ట్రబుల్ ఉంటే మనం అసిడిటీ అనుకోని, బ్లోటింగ్ అనుకోని వి జస్ట్ పోస్ట్‌పోన్ ఇట్. వి డోంట్ సీ ఎ డాక్టర్ ఫర్ ఎ లాంగ్ టైమ్.
So first, IBD we can divide it into two things. One is ulcerative colitis. The other one is Crohn's disease. Ulcerative colitis most of the time pretty forward, straightforward ఉంటుంది. ఏంటి అంటే they have symptoms of diarrhea, frequent diarrhea, increased frequency of stools, and sometimes they present with blood in stools. So that's people see that as a symptom, and then immediately they come to us. But the second one is Crohn's disease. Crohn's disease has a lot of non-specific complaints. So sometimes they present with oral ulcers, recurrent oral ulcers. They can just present with a perianal abscess. Motion area lo swelling ఉంటుంది, pain ఉంటుంది, perianal abscess. And they go to a general surgeon and they identify a fistula. And they get operated for that abscess and fistula. And ultimately, these young people, they turn out to have another fistula in next six months. So this is actually Crohn's disease. These are uncommon presentations, and I mean they are not uncommon, but they are variety of presentations actually.
Which you don't think to consult a
Don't
gastro.
think of Crohn's disease unless there is a lot of awareness about Crohn's disease. People don't understand that there is something else going on. And most important thing is abdominal bloating. And over a period of time, when the severity increases, they may land up to you with obstruction. The intestine can go into complete obstruction, where it can be a medical emergency, where they need a surgery and removal of that part of the small intestine.
సో మీరు చెప్పినట్టుగా అవేర్నెస్ ఇస్ ఆల్సో వెరీ ఇంపార్టెంట్ ఫ్యాక్టర్. ఇట్స్ నాట్ జస్ట్ అ వెస్టర్న్ డిజీజ్ ఎనీమోర్. మన ఇండియాలో కూడా చాలా మందికి ఇది డయాగ్నోజ్ అవుతుంది. సో డాక్టర్, ఇది టాకింగ్ అబౌట్ ఇది లైఫ్ స్టైల్ డిజీజ్ అనుకున్నాం కదా, బట్ ఎనీ రోల్ ఆఫ్ జెనెటిక్స్ అంటారా దీనికి?
Definitely. See, there are a lot of research that these are specific genes which are seen in patients with IBD. And in India, we have all those genes which cause IBD.
Oh, that should be alarming.
In spite of all these things, 25 years ago, we have seen very, very less cases. Even though we have those genes, these environmental factors, the most important environmental factors are food. This food has changed a lot in the last few years. Because of that, we are prone because of this genetic makeup. And when this food added up, we are presenting it as a disease. So it's a combination of genes and environmental factors, and predominantly it is the food which I say environmental factors.
సో డాక్టర్, ఎవరన్నా పేషెంట్ మీ దగ్గరికి ఈ సిమ్టమ్స్ తో వచ్చినప్పుడు, అండ్ వెన్ యూ సస్పెక్ట్ ఓకే దిస్ క్యాన్ బి ఐబిడి, అలాంటప్పుడు మీరు ఎలా డయాగ్నోస్ చేస్తారు?
So we first need to differentiate whether it is irritable bowel syndrome or an inflammatory bowel disease, something like Crohn's disease. So first simple thing what I would like is to ask is any alarming factors like is there any weight loss, is there any blood in stool, or is there any recurrent symptoms? These are the three things. And when I need to make a single test for a diagnosis or differentiation, first thing what I would ask is for a stool test called fecal calprotectin. Today fecal calprotectin అనే టెస్ట్ చాలా వైడ్గా అవైలబుల్గా ఉంది. If fecal calprotectin is elevated, I definitely suspect IBD, and then further investigations are again differentiated. If I think it is ulcerative colitis, I directly go ahead with few blood tests and a colonoscopy. I would be able to make a diagnosis of ulcerative colitis. If I am suspecting Crohn's disease, then definitely along with blood tests and a colonoscopy, where I will intubate the terminal ileum also, we call it as ileocolonoscopy, I would like to do a CT or MR enteroclysis, where I would be able to see whole of the small intestine also.
సో ఒకసారి డయాగ్నోస్ అయిన తర్వాత డాక్టర్, ఐ మీన్ పేషెంట్స్ లైఫ్ ఎలా ఉందంటారు?
Most important is timing of diagnosis. If I make a diagnosis very early, so I will be the target of treatment in IBD patients is bringing the disease into remission. అంటే disease యాక్టివిటీని కంట్రోల్లోకి తీసుకుని రావటం. I call this as remission. And once I bring it, that is the first target. ఒక్కసారి కంట్రోల్లోకి వచ్చిన తర్వాత ఆ కంట్రోల్, ఆ రెమిషన్ని మెయింటైన్ చేయాలి. This should be done lifelong. If I can achieve this remission and maintain this remission, quality of life is not hampered. They are as good as any other person, even if they have this disease.
So they can continue going to work, doing their own
Everything will be normal.
activity.
Everything will be normal. Only thing is, making this diagnosis early plays a very, very important role. And we have a lot of medications. If it is ulcerative colitis, most of the time it is tablets which can heal the disease. Otti tablets tone. If it is Crohn's disease and I'm seeing a patient less than 40, most of the time we are treating them with biological injections.
But are there any precautions? I mean, they have to follow, like when they are traveling or they are in the public places. వాళ్ళకి a fear ఉంటుంది కదా.
Definitely. See, most important reason for flares. When people are in remission, they can go back into flares. In India, if you ask me what is the most important reason, it is infection.
Okay.
Food and water contamination is very, very common. One infection, obviously when they travel, they may have to eat outside. So this is a serious thing which I would consider and ask them to avoid eating outside. And simple infections can flare the disease. Control lo inni rojulu control lo unna problem suddenly infection valla it will flare up.
So talking about diet, doctor, మీరు చెప్పినట్టుగా diet plays a very important role, especially in this condition. So when a particular diet ఉందా that they should follow, certain foods that they should avoid?
Most of the time, high fiber food, or some people who are allergic to, not tolerating lactose, we avoid milk, we avoid high fiber diet. But lot of studies says food will not affect the disease activity. Once you get them into control, when the disease is in remission, they can eat anything normally. There is no food restriction at all.
So having studied gut so closely and watching gut so closely, is there any gut secret that you follow personally?
See, what I strongly feel is, every person, if we are born in a place, we have a native gut bacteria. So native gut bacteria is determined by the type of food you eat. For example, if I'm in India, if in specifically South India, most of us, manakenti ante, we eat good amount of curd and buttermilk. That is a good probiotic for us. So recently there are a lot of studies which say gut microbiome determines your gut health. Not just gut health, it determines your general health also. So definitely your diet should be very close to your nativity.
So what's your secret? What's your personal health secret? And do you follow any particular diet or any food that you consume?
I would suggest, not suggesting, what I'm trying to do is increasing good amount of fruits and vegetables in my diet, but there should be adequate protein. Protein is most of the time is from eggs and non-vegetarian. I will have definitely some amount of non-vegetarian, definitely. And most importantly, as I was talking, having good amount of curd or buttermilk is definitely important. It should be part of your diet regularly.
So what advice you would like to give to the youngsters, especially today?
So suggestion would be for the youngsters and the parents also. See, definitely please avoid processed and ultra processed foods. Ante packed foods, please avoid them. Try and eat fresh fruits, fresh vegetables, freshly cooked food. These are the most important things which changed the disease course, and చాలా ఎక్కువ డిసీజెస్ మనం చూస్తానికి ముఖ్యమైన కారణము, and IBD also.
So talking about IBD, doctor, what is that one myth that you would like to clear for everyone and what everyone...
Same thing, I would say IBD is not a Western disease anymore. IBD is there in India. We are seeing lot of IBD cases. Anyone with gastrointestinal symptoms, please don't make self-diagnosis. Don't think it is IBS, and don't think it is something gas or anything. It can be IBD. IBD is highly prevalent in India. So I can say few numbers actually. At least 70 to 80 people in 1 lakh in India have ulcerative colitis. At least 10 to 12 people out of 1 lakh has Crohn's disease in India. So IBD is not rare. IBD is a common disease today. Get evaluated, get diagnosed early if at all there is a thing, and start your treatment as early as possible to avoid complications.
That's very well said and chala simple ga chepparu, but I'm sure most of us should follow this after listening to our conversation at least.
Right.
So thank you, Dr. Somasekhar sir. It was wonderful interacting with you.
Thank you very much.
So this brings us to the end of this episode. Hope this episode was informative on the topic inflammatory bowel disease and it was helpful. Remember, your gut is talking to you and you just have to listen. And don't forget to tune in next week as well. Until then, take care and stay healthy. Thank you.